Initiative for Health Accountability and Transparency. Welcome you to Leadership Management and Governance Module 5, which is on dimensions of accountability in the health system. Let us look at the outline of this presentation. We'll be looking at the introduction, the concepts, objectives, and types of accountability. We'll speak on accountability actors and the relationships in the health system. We'll also talk about the types of accountability mechanisms, the effects of failed accountability in the health system, and finally, on strategies for improving accountability in the health system. The learning objectives of this module primarily is that at the end of this module, the participants will be able to explain the concept of accountability, describe the objectives, types of accountability, accountability relationships in the health system, explain types of accountability mechanisms. They will be able to discuss the effects of failed accountability in the health system and discuss strategies for improving accountability in the health system. Let us look at key issues as it affects accountability in the health system in Nigeria. Health system in Nigeria is characterized by persistent service delivery challenges and failures, and this has resulted in poor health outcomes compared with other low-income countries. Poor governance and lack of accountability has been cited as one of the underlying causes of poor performance in the health system in Nigeria. There is pervasive lack of accountability and transparency, which occurs in various forms at all levels of the health system, resulting in waste of resources and lack of value for money. There are numerous testimonies of unattended and unresolved cases of abuses, frauds, and waste, and non-compliance with professional ethics, procedures, and standards. In the absence of accountability, merely allocating public resources for health goods and services may not necessarily give good results. Therefore, improving accountability is an essential element in improving the health system performance. In health service delivery, accountability is predicated on relationships between the ones making the decisions and those providing services and those affected by them, that is, the clients receiving services. Focusing on accountability can increase our understanding of health systems operations and lead to better understanding of the health system design. What is our understanding of accountability? Accountability primarily is the obligation of individuals or institutions, the agencies, to provide information about their actions or to provide justifications for their actions to other actors. And it also includes imposition of sanctions for failure to comply or to engage in appropriate action. So we can say it's a two-way traffic. You must provide information or justification for your actions, and it also involves imposition of sanctions for inappropriate action. It involves measures to ensure that the person or organization or an institution with the authority to provide a service actually delivers that service. That is, the providers and policymakers are answerable for their actions, and they must demonstrate that they have delivered what they are supposed to deliver. There are growing concerns for accountability in the health system. Why are there growing concerns? The concerns are premised on three fundamental issues. The first is that there is dissatisfaction with the health system performance. A lot of discontent on service availability and access and quality. There are issues of cost escalation. There are issues of abuse of power by the providers and institutions. There are lack of responsiveness to needs and demands of the clients. There are also cases of financial mismanagement and corruption. The second issue has to do with the size of the health budget. Healthcare budget constitutes major budgetary expenditure, and properly accounting for the use of funds is often a very top priority. The third issue is the issue of the power of the actors. The size and scope of healthcare bureaucracies accord the health system actors significant power to affect people's lives and well-being. Therefore, everybody is interested in accountability in the health system. Now, what is the crux of accountability? The essence of accountability is answerability and the obligation to answer questions regarding actions and decisions. And it's centered around two types of questions. The first question has to do with information. Actors will ask for information, and this can include budget information or narrative description of activities that has been undertaken or their outputs. The second question is often on explanations and justifications or reasons for actions or inactions. Let us take a minute and brainstorm. Do you think accountability barriers to health development in Nigeria are significant? And what are the everyday issues of accountability in the health system, in the areas where you work? Now, the kinds of failed accountability, we can group them into three classes or categories. The first has to do with health development projects and programs. And many examples are in the area of mismanagement of contracting process. In many contract processes, there are infractions. The other aspect has to do with abandonment of uncompleted contract. You see uncompleted facilities, they are everywhere. It also has to do with abandonment of supplies and donated items. It's not unusual to go to CPOS or even stores and you see supplies and donated items that are not being used. There is also diversion of operational vehicles and other supplies and even equipment. The second category has to do with health and medical service delivery. This is where you see a lot of abuses, breaches of standards and procedures, and they include unofficial payment, what we sometimes call as under-the-table payment. We also have professional misconduct and practices and medical negligence. And another important aspect under this category, which is very worrisome, is absenteeism. There are also reported cases of using unqualified, that is uncertified personnel. There are kickback schemes, diversion of clients or self-referral, and even providing unnecessary care in some instances, just for financial gain. The third category has to do with provider payment system. There are multiple infractions on provider payment systems, and they include false claims, waiving co-payments, improper coding, and upcoding. Now, we can also take another brainstorming session. What are the objectives of accountability? We talk about accountability very frequently, but what objectives do we have in trying to promote accountability in any system at all? Now, there are three broad objectives of accountability. The first one is to ensure compliance with ethics, procedures, and standards. Medical and health practice are predicated on ethics, on procedures, and standards, and there are often the possibility of infractions. So the first objective has to do with ensuring compliance. The second has to do with reducing abuses. The potential for abuses are common. So one of the objectives is to try as much as possible to reduce abuses. And the third objective is to improve performance of the health system. Let's take another brainstorming session. What are the types of accountability in the health system? Let's look at the three major categories of types of accountability. What we deal with every day, you hear, is about financial accountability. This money is given for this. Has it been well accounted for? Therefore, this area deals with compliance with laws, regulations, and rules regarding basically financial control and management. Have you got the value for the money? The next category has to do with performance accountability, and this deals with performance measurements and evaluation and service delivery improvement. You have set targets. Have you attained them in terms of performance? That is what this category deals with. The third category, which is very key and very important, is what we call political or democratic accountability. And this deals with the relationship between the state and the citizen. And it's focused on issues that has to do with increased citizen participation, openness, equity issues, transparency, responsiveness, and trust building. Now, the fourth brainstorming exercise. What are the accountability actors in the health system? By this we mean, who are the players in the accountability landscape? If you do detailed categorization of the actors, you will find the first group certainly will be the health service users, patients, or the clients. And these are the customers, the health consumers, and they are the central focus. And they must be able to hold service providers accountable by exercising their rights and the options for either voice or exit, particularly with respect to prepayment, provider payment systems. The second category are the federal and state ministries or health, and they are the predominant actors in accountability relationship. And this is in terms of holding healthcare providers accountable and also being accountable to other branches of government for funds that are appropriated for health service delivery, and also indirectly to the citizens. Another category is the healthcare providers, the institutions, and individual providers. They are key actors in health system accountability, and they are subject to a wide range of accountability demands from other actors like we have mentioned, the patients, the government, the NGOs, the citizens. We also have the regulation and control agencies, and these include multitudes of state entities that make up the institutional structure of check and balances for all the three types of accountability. The professional regulatory bodies and agencies are central because they play a very key role in regulating and controlling practices. There are the NGOs. NGOs are involved to aggregate the interests of the citizens and also for advocacy. And they often collaborate also with the media to disseminate message information necessary for citizens to hold public health officials and agencies accountable. We have the legislators. In Nigeria, the National Assembly, both the House of Representatives and the Senate. And incidentally, both of them have the health committees. The key role in administrative chains of political and democratic accountability, particularly with respect to budgeting and oversight. Professional associations and unions, they are actually the definers and guarantors of effective medical practice. They have an implied contract with society to hold their members accountable. In some cases, the union seeks to fulfill functions similar to professional associations, particularly with regard to standard setting. There are other legislations establishing key institutions such as Office of the Auditor General, the MDAs, regulatory and anti-corruption agencies, and mandating them to lead the process of providing accountability in certain. It is to be noted that the Office of Auditor General of the Federation is very key, and similar structures also exist at the state level to ensure that funds are used for what they are provided for, and also in line with extant guidelines concerning financial regulation and control. We should not forget the funding agencies. The Ministry of Finance and the Insurance Fund Agency are very, very key. Their responsibilities are very, very fundamental. They provide annual health budgets envelopes, and they ensure that funds are disbursed based on spending plans and targets. And the Ministry of Health report on and account for funds that are budgeted and spent. We must not forget the Insurance Fund Agency as a key actor in accountability relations in the health system, particularly where payment and provision are separate, and providers are reimbursed for services based on a capitation or any other formula. The National Health Insurance Scheme and the state health insurance schemes are very, very key with respect to this particular group. What processes are available to enhance accountability? That is, what are the types of accountability mechanisms? We are looking at the types of accountability mechanisms, and we'll focus on 4 of them. The fiscal accountability mechanisms, the legal and regulatory accountability mechanisms, administrative accountability mechanisms, and not the least, the social accountability mechanism. Now, let's look at the fiscal accountability mechanisms. This mechanism focuses primarily on financial integrity and performance of public institutions, and is often played by different actors and implemented using a variety of approaches. And this concerns monitoring and reporting on allocation, disbursement, and utilization of financial resources. And there are multiple tools that are used with respect to these mechanisms. The tools of auditing, of budgeting, and of accounting. There is the legal and regulatory accountability mechanisms. The legal and regulatory accountability mechanism is usually provided for by the Constitution, and there are other health sector specific legislations and policies that provide for establishment of institutions, organs, and systems for operationalizing accountability in the health system. In the health system, there is the National Health Act, the National Health Policy, and other numerous policies with specific provisions for health service regulation that help not only to guarantee minimum standard, but to ensure compliance with ethics, standards, and procedures. There is the administrative accountability mechanism, and this refers to structures and strategies that are put in place by government to ensure public institutions and public servants adhere and meet performance targets that focus on services, outputs, and results, and responsiveness to citizens, and achievement of service delivery targets that meet their needs and demands. It refers to answerability of those with delegated authority for carrying out tasks according to agreed performance criteria, using mechanisms that reduce abuse, that improve standard adherence to standards, and foster improved performance in general. And with respect to this, we have Servicom playing a key role as an administrative accountability mechanism. The last but not the least, but very, very key and very important, is social accountability. And it refers to the broad range of actions and mechanisms that are used by the citizens, by the public, to hold accountability actors to account, as well as actions on the part of government, civil society, the media, and other society actors that promote or facilitate these efforts. It is actually a mechanism for mobilizing citizens to demand for more responsive service provider, to reduce corrupt tendencies, and to improve the quality and availability of healthcare. This includes systems supported by non-state actors such as the community, the civil society organizations, and the media. What are the effects of failed accountability in the health system? We've spoken earlier about the concerns for accountability, and we looked at key issues surrounding the growing concern for accountability. So what is the effect of failed accountability in the health system? Failed accountability has several effects. One is that well-intentioned spending may have no impact at all. The other one is that national health priorities, goals, and objectives cannot be made in the face of failed accountability, and scarce resources will be wasted. We must also note that failed accountability fuels abuses. It fuels non-compliance with ethics, standards, and procedures, and therefore undermine healthcare delivery and result in poor performance. Measuring accountability based on corruption indicators shows negative correlation with a number of healthcare indicators. It has to do with child and infant mortality, the skill birth attendance, the immunization coverage, and also low birth weight. It is also reported that a 10% increase in corruption reduces immunization rates by as much as 20%. public health programming, maternal, newborn child activities such as routine immunization, family planning, and control of killer diseases are often at great risk of failed accountability. Like we said earlier, absenteeism poses serious challenge to access to basic services. Corruption can affect availability of equipment, public health supplies, and even infrastructure, like we have mentioned earlier, abandonment of projects and supplies. Reducing corruption can result in significant social gains as measured by decrease in child and infant mortality rates, as well as percentage of low birth weight babies. It is important that we mitigate the effect of accountability. To do this, we need to identify strategies for improving accountability in the health system. You can take some seconds and just put 1 or 2 points down on what you think should be the strategies for improving accountability in the health system. Now, looking at accountability strengthening strategies, there are 3 categories of strategies. The first one is mapping accountability linkages in organizations. And this involves the use of accountability matrix, which is an assessment tool to mark accountability linkages and to examine how the actors interact. There is often interdependencies and interconnections among accountability actors in the health system. Therefore, this matrix is used to track the patterns of answerability and sanctions in terms of which actors are charged with supply information and are subject to sanctions. The second approach is developing accountability enhancing strategies. Accountability enhancing strategies can be organized around the 3 accountability purposes which we have highlighted earlier: reducing abuse, assurance of compliance with procedures and standards, and improving performance and also learning. In practice, efforts to increase accountability are likely to include more than one of these 3 purposes that I have just mentioned. And under this category, the first thing is to evolve strategies for reducing abuse. It focuses on containment of fraud, misuse, and corruption. It is a pillar for compliance with standards and performance improvement. And it is good to note that areas where increased accountability can help combat abuse includes contract procedures, both for facility constructions and for service provision we mentioned earlier. There are often infractions in this regard. Another area is pharmaceutical purchasing. It must be competitive, it must be open. There must be value for money here. And also in distribution and in prescription. We must not forget collection and management of user fees, personnel management, and informal activity of the health workers like we mentioned earlier, particularly with regard to under-the-table payments and absenteeism. The next one is assuring compliance with procedures and standards. Accountability strategies that target compliance with procedures and standards include things like regulation, which is the duty of the regulatory agencies, particularly with respect to professional practice, the oversight, the monitoring and reporting the requirements on the answerability side. And sources of sanctions in this particular respect include a legal framework, the judicial system, that is the courts, the administrative rules, the operating procedures, the markets and quasi-markets, professional norms and ethics. It also has to do with licensing and accreditation and social cultural values. The next one has to do with improving performance and learning. Accountability strategies intended to improve performance and promote learning often include clarification of chains of accountability to determine who is responsible for what, clarification on roles and responsibilities. The next has to also do with shortening the chains to make feedback on performance. It should be made more direct and also more timely. And finally, making the chains more powerful to increase incentives for responsive performance. Improving performance and learning also include increasing hospital autonomy so that facility performance is more directly tied to actions of hospital managers. Patient Bill of Rights and agency chapters are examples of measures to specify provider responsibilities and performance expectations. Various provider payment schemes that seek to create monetary incentives for better performance and responsiveness to clients is under this category. The third category of the three approaches, strategies we've mentioned from the beginning when we talked about the mapping, we talked about accountability strategies, and we are now talking about accountability targets. Accountability enhancing strategy can select targets at different levels of the health system, the system level, the facility level, or individual health provider level. And the system intervention should include national health reforms, particularly those that reinforce or modify the regulatory framework, or that assign functions among health sector actors. For example, looking at establishing contract for service delivery, separating payment from provision, or decentralization of pharmaceutical procurement. We have looked at several aspects of accountability. We have tried to explain what accountability means, what are the different types, what are the mechanisms, what are the objectives, what are the effects, what strategies are available. And we can conclude by saying that increasing accountability is a key element in a variety of reforms, from anti-corruption campaigns to system reform programs to decentralized health service delivery, and also to community-based initiatives like the community-based health funds. One of the main reasons why this range is so broad relates to the interconnections we have mentioned among the various types and purposes of accountability. Financial accountability quickly leads to performance issues, and these two combined have implications for political or democratic accountability. At IHAT, our vision is a health system governed by accountability, and achieving this will require strong leadership, effective management, and transparent governance. For us at IHAT, we are committed to these values and will be investing a lot of time in collaboration with our partners to focus in strengthening leadership, management, and governance in the health system.